No, okay. Are we live? All right. Hi, everyone. Thank you for joining us for the first rollout of our Allegheny County Birth Plan for Black babies and families. And Birth Plan stands for Battling Inequities and Realizing Transformational Health Outcomes. I'm Jada Sherrill, Chief Executive Officer at Healthy Start. And I am joined today by Danae Wilson from the Allegheny County Health Department Family and Child Health Division, and Alicia Davis with March of Dimes, two of our birth plan co-conspirators and maternal and child health strategy team original members, part of a huge, just two folks, part of a huge team of community members and stakeholders that came together to bring this plan to fruition. So thank you, Alicia and Danae, for being co-pilots today as we excitedly roll out this plan in Allegheny County. So our goal for today over this next hour is to walk you through the plan, answer any questions that you have, talk about basically where the plan lies so that you can easily access it, share it. This is a pretty comprehensive plan. There is a condensed version also for a quick read and a quick share. You can go to our website and give feedback. We welcome feedback on an ongoing basis because we do want this to be a live process, a living document and a living process as we work toward better outcomes in our region. And then talk about next steps and how we can get this plan in front of more audiences. Before we get started, Danae, Alicia, anything either of you want to add? Okay, all right, so I will start to walk us through the plan. So just a little bit of background. I won't say it's the culmination because it's not an endpoint, but it's where we stand now after over 3 years of work collectively to come together and say, you know, a lot of folks are doing a lot of great work around supporting better birth outcomes, around addressing Black infant and maternal mortality in Allegheny County. But how do we all get on the same page? How do we begin to work more effectively together? How do we reduce some of the duplication? How do we set some collective targets? How do we get a better understanding of what is the status of the county and where we need to go? And so we started a process a little over 3 years ago of convening. It was a Healthy Start, the health department at that time. Alicia was at the health department. We didn't have a local March of Dimes representative at the time. Pitt Graduate School of Public Health, Center for Health Equity in Allegheny County Department of Human Services. And we were guided by a national practitioner of health equity, Dr. Vijaya Hogan, in this process of exploring kind of what is the problem, what can we begin to put in place or build upon, because there's already a lot in place. What can we begin to build upon that's already in place that will give us a more clear guide and roadmap? So we had a wonderful process. We did some social network analysis. We did some equity analysis, a lot of activities to really understand the context, do some benchmarking, and develop an action plan. And so we ended with a plan, and then we planned to roll out to the public, and we got hit with the pandemic. But you know, the pandemic also provided opportunities for additional funding to explore a number of inequities. So we know that our Black community has been hit harder with COVID, and we know that we still, despite the challenges that the pandemic poses for us, we still have to lean into this work. And so funding was made available specifically for Healthy Start programs across the country to develop action plans. So this was a great opportunity in Allegheny County to build off of the work that had been started through that initial maternal and child health strategy team. So we worked from, I think it was about November through March on this plan. We worked to engage community to make sure that this plan reflected a number of voices. It is by no means exhaustive of every voice or perspective, but it is a very strong and comprehensive guide that I think we should all be proud of. And it is it's not Healthy Starts plan. It's not the county's plan or March of Dimes plan. It's all of our plan. And like I said, it's a living active document that we hope that community will continue to invest in. So I'm going to take us through the pages. So this is the cover. The art was very important, or the imagery for the plan was very important. Again, our focus is Black babies and families, and we know that as we work to reduce the inequities, everybody will see better and healthier outcomes across systems and in our communities. So thank you for our partners, the health department, Family and Child Health Division, in particular, March of Dimes, Allegheny County DHS, University of Pittsburgh, and the Infant Health Equity Coalition. So the coalition is the broader group of stakeholders that came together to guide us through this process, and we'll get to that list in a little bit. This inside cover page shows you how you can reference this document. So we do hope, again, that this document will be used widely to guide activities and will be referenced in whether it be research, whether it be in student publications. We all get a lot of calls from students who are doing research or exploration around Allegheny County's infant and maternal mortality rate. So this document now can be in our book of assets in terms of really strong processes that can be referenced. So there is the reference. And then of course we have to say thank you to our federal government for the funding to do this action planning process. This is a list of acknowledgements, lots of folks and stakeholders that this work would not have been possible without. Again, our strategy team, our consultants that led us through and ushered us through the process in a very short time. It was a lot of work to do. We wanted to make sure that community voice was represented and that we had a strong process. And so, thank you so much to our consultants, Elise Pinchback Johnson from Pinchback Consulting, and Vanu, and I never want to mispronounce her last name, from Population Health Consultants. And I mean, they were just phenomenal and fabulous with a lot of expertise in community engaged processes and public health. The book was put together and laid out by Dre Media Solutions. Thank you to the Healthy Start Board, again, all of our partners and our funders, and the families and community that participated. And again, we'll get a little bit more into the ways that we specifically engaged community through this process. This is a message from me. Just wanted to set the tone for the report, wanted to keep at the forefront that this is a continuous journey for us. This is not an endpoint. We need to continue to be critical and reflective of our systems, of our own organizations, and make sure that we are all headed in the same direction. So executive summary really lays out the context for how we got here, gives you some data. We did pull from the Gender Equity Commission report. I think that, one of the things that we've settled into is the fact that this process and the Gender Equity Commission report provided a great opportunity for folks in a broader audience to start paying attention to this issue. And locally in Allegheny County, we've seen a lot of additional parties interested in how we work together to reduce the Black infant and maternal mortality rate as a result of the report. So we've used a lot of reference to national and local data to help set the tone and the context for our focus on social determinants of health. So resulting from our activities, the group came up with 4 areas that we feel as a county we need to be focused on. This was the synthesis of a lot of data, a lot of activity. We did a lot of benchmarking. We did some literature reviews. There are a lot of existing documents, the county's birth plan. We have our perinatal periods of risk studies. We have some other documents and work that Healthy Start has done. We have a lot of documents that some of the scholars within the process have brought to the table. So we really wanted to comb through those existing documents and incorporate those and say, what are the gaps? where do we need our community to support us in digging a little bit deeper and seeing where we need to be focused. So after all of that activity, after engaging some of our community members who include Healthy Start participants to reach out to additional folks and do some surveying, some question and answer, some interviews, we came up with 4 areas of focus. And they are strengthen the maternal and child health workforce, strengthen systems of care, address social determinants of health, and coordinate and streamline maternal and child health initiatives. And I think for those of us who are in this space or who have interest or who have been paying attention, most of this is not new. It's not groundbreaking, but it is reinforcement of what we know that we need to do collectively. We need to make sure that those who are working in the space of supporting birthing people, that there's diversity, that there's equity, that there's training and support, that we are supportive of not only our clinical birth workers, but also our folks that work in community, our doulas, our lactation consultants, our health educators, our childbirth educators, our community health workers. And we need to find ways to bridge the gap between our clinical and community folks who support birthing people. Strengthening systems of care. We hear all too often the ways that systems are failing people. We hear all too often the ways that needs are going unmet, the hoops that people have to jump through, the challenges and gaps that those who are most vulnerable face in trying to meet their critical needs. So we really need to pay attention to how do we engage cross systems and strengthen those systems of care for folks. For families with complex needs, who have medical needs, but also have mental health needs, who also have needs for support in other areas. How do we make it easier and more effective to get that care and get those needs met? Addressing social determinants of health. So how do we just holistically make a better environment or community around transportation, around housing, around food, all of those things that contribute to our health, around employment and economics. And then finally, again, this whole process is about how do we get in alignment together and not duplicate and create a strong and innovative way of approaching this issue that engages all of the different stakeholders that bring value to the process, but is synergistic and not duplicative. So in the pages to follow, we spent a lot of time, again, as the coalition and with our community members in really breaking down these 4 overarching themes into a series of action items. And, it is a very robust plan. It's a very robust list of action items. It's not something that's going to be accomplished tomorrow, in a year, in 5 years. Like, this is about long-term change in our infrastructure. So what you'll find in the next several pages are all of the action areas broken down into a series of detailed action items. And we've gone a step further and identified via this color code areas where different stakeholders might want to pay particular attention, or where different stakeholders might find interest in pulling out certain action items and working toward those within their own spaces. So this is a tool and a guide. It is a series of quick tables that lay out all of the action items in the front before we get into them in more detail further along in the document. So we have some more context around how we got here, and then really incorporating some best practices. So throughout the document, there are call out boxes that show us some of the promising practices locally and nationally, really with an explicit focus on highlighting and elevating those initiatives that are either Black women-led, people of color-led, and community-led, to give us context around, we know that we have gaps in care, but also there are great models out there that help us to address those things that we feel need to be addressed. The next couple pages give you some more context around social determinants of health, elevating some of the frameworks that we feel are important to understand as you dig into the document. some important notes on language. So throughout the document, we wanted to clarify and set the tone with the language that we're using. Our focus is on Black women and babies and birthing people. Fathers and partners are also identified throughout the document. For the communities that we serve, partners are not always fathers. Birthing people do not always identify as women. And so we want to be clear about language, that it's open and expansive, but also, provide some clarity around the population that we're serving, what we mean by maternal and child health, and then dig into some key terms around racism, health equity, health disparities, social determinants of health, and structural determinants of health. So I encourage, as you go through this guide, take a moment and review the language that we're using. Again, we do elevate the work of our Black women scholars working in the space of maternal and child health. So we're using the definitions, for example, of racism that Dr. Kamara Jones has provided for this space, and again, the space of public health. All right, so an equity-centered, community-driven action planning process. So this was about a 3-month process where we engaged community. We established a coalition of stakeholders across different organizations. So we had our 2 major health centers represented, Allegheny Health Network, UPMC. We also had the Midwife Center represented. We had lots of community stakeholders and birth workers, Genesis Birth Services, Birthing Hut, Brown Mamas represented in the process. Don't want to forget anyone. So again, they are all listed in the back of the document. But just want to make sure that we understand that this is a community document. This is a community plan, and in order for us to see us get to where we need to get as a community, it's going to take all hands on deck. So this is the MCA strategy team that I mentioned in the beginning that started our work, that we were able to build on through this process. Thank you for these folks for 4 years later, still being in the thick of things, making sure that we get to a point of infant health equity in Allegheny County. And these are our wonderful, some of our wonderful community stakeholders that worked with us through this process to make sure it was community engaged. Taylor Clem, Cecilia Essex, Callista Tucker, Dr. Noble Messeru, and Sarita Gordon. These folks did presentations during our town hall on some of the innovative approaches that they are personally leading and involved in around infant health equity, from the space of how we support mothers and birthing people with a village. Also some work around nutrition. Nutrition is the foundation of our health. Nutrition is the foundation of what birthing people bring to their new baby. So Taylor gave us a really exciting presentation from her personal area of expertise and passion around the importance of nutrition within the village. Stigma and underutilized support resources for families. So we know that there are, Allegheny County is home to thousands of nonprofits. So there's lots of support, but is that support accessible? Is it well utilized? And what is the stigma tied to that support a lot of times? Neonatal intensive care, unit care, and equitable workplace policies. So Callista talked about her own birthing experience, having an infant who had to be in the NICU, and how that impacted her ability, her personal life, and her ability to return to work. And so our plan touches on workplace policy and what we need to do as a community to be more supportive of all birthing people who may need to or choose to return to work, and how working is a continuum of our lives. And our workplaces need to be more tuned into what people need to be whole and work-life balance. Dr. Noble talked about public health interventions for birth equity, bringing his experience, decades of experience in the public health setting and other health departments in other cities, and some of the great work that he's done and the great accomplishments and improvements that they saw in Cincinnati. And then finally, Sarita talked to us about nurturing mom to mom. So again, this whole concept of how we as a community support our birthing people. The action planning team had very specific aims and principles that were used to guide us through the process, listening, collaborating, being strategic, and pursuing action. So again, this action plan is not meant to be a document that we have and pass around and then shelve it. It is the starting point for us to begin to pull together all of the great work and energy and efforts and keep it moving, keep things moving in a positive trajectory in terms of our work, stopping to assess what we're doing. Is it effective? Is it getting us closer to where we feel we need to be as a community? And if not, there's definitely the opportunity to redirect and reframe what we're doing. So now we're digging deeper into our 4 action areas as a collective call to action and accountability. Again, they are strengthen the maternal and child health workforce, strengthen systems of care, address social determinants of health, and coordinate and streamline our MCH initiatives. So if you remember the table that we had in the first couple pages, now we dig deeper into those action items. What were some of the concerns and challenges that we're trying to address through this plan? So in strengthening our maternal child health workforce, what we heard from our team was there's not enough diversity. Community members are not adequately represented by practitioners and providers. A lot of folks want to see providers that look like them, that have similar lived experiences or understand the lived experience. There's not enough training. We don't understand the workforce pathways. There's not enough transparency there. And there is an imbalance of power. So those were some of the issues that we framed as we dug into what are some of the solutions, what are some of the actions that we feel we can outline and define in order to address these barriers. Then we talked about what the community members say. So again, part of our process was to have community members do feedback projects to lend to this process. So we got direct quotes from members of our community. So those direct quotes are incorporated into this document, again, to give us a very holistic perspective. It's not just about data and numbers. It's also about listening to the voices of the community that we serve and making sure that those voices are reflected. What we hear a lot is a lot of Black women fear having a child, wondering if they will make it through childbirth. Then someone says the most positive experience I've had is that of a provider who really takes the time to listen to my concerns or issues. When we talk about the needs that community members expressed, someone said we need the support of doulas who are looking out for mom and have the abilities to successfully navigate the healthcare system using the proper verbiage, and can also support the mom in navigating the millions of unplanned things that happen to women. So then we get into our action items, and I'm not gonna read them. I really encourage you all to take the time to download the document, spend some time with it. Again, it is a lengthy document. It's very in-depth, and there is a quick guide, but it's a lot of great information and a lot of hard work went into it. Throughout, there are key resources identified. And those key resources we made sure were resources that are equity focused. So here, when we're talking about ensuring equitable pay and benefits, as part of our MCH workforce pipeline, we draw you to the Women's Law Project that works to include a focus on equal pay. And the Women's Law Project is an organization that Healthy Start draws on when we need support or guidance around, for example, supporting breastfeeding policy in the workplace. When we have moms who need some specific information and answers on what are their rights in the workplace, we go to the Women's Law Project. So again, take the time, work through this part of the document, just goes in depth with our action areas, and it's the same format through each of the 4 action areas. So you'll see there is the specific action area, there's all the sub actions, and then there are examples of programs. Some of them you may be aware of and some of them may be new to you. that show best practices. So I'm going to quickly go through. So then we get to our appendix of our Infant Health Equity Coalition members, just so you can understand the breadth of stakeholders involved in this process, and the voices that came to the table. And it's our goal collectively to hold each other accountable and staying engaged in this process. It's alphabetized, but we see at the top Gateway Health, one of our largest managed care organizations, touching thousands of families of birthing people in Allegheny County. So it's important that we keep Gateway Health at the table. They're now called Highmark Co-Care. It's important that we keep them at the table, that we keep them involved and invested in this work, because they're responsible for, you know, our Medicaid dollars and our families and birthing people that have that insurance. And then Appendix B is a list of stakeholders that have some focus on maternal and child health and or social determinants of health. So as we continue to roll out this plan, we need to be thinking critically about how do we continue to engage these stakeholders? What can they bring to the table, to the process? What's important to them? What are their priorities? What do we all need to be prioritizing together? Where do we need to have some commonalities? And that's it. So that is kind of the quick walkthrough of our birth plan. Want to share where you can download our birth plan. So it is available on the Healthy Start website. I'm going to navigate and share screen to take you through to where you can access the birth plan. I'm going to try to correctly share my screen. Nope, that's not where I want to be. My coworker wants to be in the, okay. So anyway, the birth plan is located on our website. So if you go to healthystartpittsburgh.org, and those who know me know I struggle with technology. So I think I'm there. Okay. So here's the Healthy Start website, and you would go to community programs, and the first tab is birth plan. And so you would click that. And this is a page that focuses on our, that went live as we started the process to keep the public engaged in our infant health equity planning process. But now that we have the birth plan, you can go here and download it. So you can click here to view the Allegheny County birth plan, and you can click here to view the quick guide. And so again, the quick guide is just a condensed version that's a quicker read, a little bit easier to understand. And then you can, you know, scroll the rest of the web page to see some of our previous activities. Right here on this link is where you can provide feedback to the birth plan. So we encourage you to spend some time with the plan and give us feedback. And one of the feedback questions is, in what ways would you like to be involved in implementation strategies? That's very important. You know, when you give feedback, someone will get back to you. If you want to be involved, someone will get back to you. When you provide your assessment of the plan, we will review that as a coalition and really figure out, how do we incorporate it? Again, we view this as a living process, a living document, and it's critical that we have community feedback. So with that said, I welcome my colleagues, Danae and Alicia, to talk a little bit about your work, how you see your work intersecting with this birth plan and being carried out in Allegheny County via the birth plan.
Danae, you want me to go first? Okay. Hi, everyone. My name's Alicia Davis, and first and foremost, I'm a mom. I'm a Black woman. I'm a trained doula, lactation counselor, and so working in maternal and child health space for me is not just something that I do in terms of my career and my 9-to-5 job, but for me, it's really a passion. And when you look at the data and you look at the numbers and you know that people that look like you, your family, you are included in those disparities, it really makes this work so real. And so that's why I'm here today. And that's why I joined the team, continue to do this work. And so I do work for the March of Dimes as a director for maternal and infant health initiatives, representing the Western PA market. And so everything that Jada said really aligns with the March of Dimes' mission. And so when we think about our mission, we really focus on 3 areas: research, advocacy, and education. And all those things are included in this report, in this plan. And so how I see the March of Dimes using this plan is really to elevate specifically the policy priorities. For example, paid family leave. We know how important that is to all parents. And so how do we make sure that our lawmakers know that this is a priority, and what can we do to support it? And so I really see the March of Dimes as being that partner around advocacy, and making sure that we are having systems level changes, so that we can start to see the data change and the lived experience. We want people to come back and say, I had a baby and this was my experience and it was great and I feel supported and I continue to feel supported after having my child. And so that is ultimately what we want. So thank you. And I'll pass it on to Danae to share.
First, I want to say, congratulations to everyone who took part in helping this birth plan to come to fruition. It was a lot of years of meetings and discussion. And I think it was time for these organizations to come together to really do a deeper dive into how can we resolve this collectively, because we tend to do things in siloed. Everyone wants to do or have an impact on the problem from their individual space. But what we've learned over the years about infant mortality and maternal mortality, that it's complex and multifactorial. And therefore, in order for us to have an approach, it had to be comprehensive. And everyone had to be a part of the decision-making around how do we actually get there. So I think this, in that arm, I'm proud to say that Healthy Start was leading this charge, both nationally and locally in Allegheny County. As a Healthy Start participant myself, it's just amazing to see the growth of the organization. And also as a board member of Healthy Start, it just really is, it makes sense for an organization like Healthy Start to be in this leading role, because it's always been its mission to focus on Black birthing families in Allegheny County. For my role, I see the Allegheny County Health Department. Many of you know, we have a new director, Dr. Bogan, who's a pediatrician, who also is very passionate about how do we improve health outcomes for the maternal and child health population in Allegheny County. So with her support and the support of our office, we will continue to be making sure we make data available, right? So that we actually understand the context of the work. As you know, we get that data from the state, from our vital stats records, both birth and death records, which make it very difficult. We know nationally that data doesn't come, isn't available as quickly as we would like. So I always feel like we're chasing behind the problem. But what we do know when we get data is that it gives us an opportunity to understand what is happening for all populations. And then we can then make accordingly our engagement with community very specific and well-defined. And then we can also work with community to think about implementation strategies. So I do think data has a very critical role in our work, but most importantly, and what I've learned over these years is hearing from community and also hearing from multiple stakeholders allows us to understand how complex this challenge to improve health outcomes for everyone actually is. And I appreciate Jada earlier for mentioning specifically that if we improve the odds and circumstances for Black families in Allegheny County, it goes without saying that everybody will experience the benefits. And I really want to stress that to all of our stakeholders and partners who might be thinking like, why would we focus on Black families specifically? And that's a question we hear a lot. I think it's important to note that you can't take away resources from one community to support another. If we do not deal with this problem head on, we will all have to pay for it later. So I think it's important for us to really think about prevention strategies, to think about, as Alicia stated, structural and system strategies that we can employ collectively across organizations and systems that would help all people to be healthier. And that's the goal. So I'm really excited to be a part of the process. I was really excited to be able to be at the table from the beginning to now. Like Alicia said, being a mother myself, being a Black woman, and also just really having this opportunity at the health department to support some of the work, our data collection, the engagement of community, and just really thinking about ways that we can transform ourselves from internal aspect that ends up resulting in our work being realized in community in a very collaborative way. So thank you, Jada, and to the team, Pop Health and Pinchback Consulting. I've never met contractors or consultants that were really, I think, top notch in helping us to follow through with this process, because we couldn't have done it without them. And so I echo Jada and really just appreciating the contractors and consultants that really help us drive this process.
Absolutely. Just, again, celebrating the consultants because they made the process seamless, and just excited to, Venu's not Black, but to have a team of women of color that have executed this work as we always do. And again, it's the altruistic work that we do that benefits everyone. But if there's anyone who is going to quote unquote save ourselves, it has to be us. We have to be leading this work. We have to be resourced to lead this work. And ultimately we have the answers. It's just a matter of being able to come together and get the work done. And so I can't say enough how much I and Healthy Start relies on partners like the health department. Danae, you mentioned data, and we're part of a cohort with the state and AmChip, and we talked about what are some of the barriers to data and what are some of the challenges. And some of our state partners talked about barriers that they have even internally to getting data. So like at the state level, DHS sometimes struggles to get data from the State Department of Health. And I was able to say, well, I get my data from the health department, our local health department, and they deal with all of the challenges of reaching out to the state. So, can't say enough how much we rely on each other. Alicia, you are our guidepost now that you're at March of Dimes for. Where do we need to be focused on in terms of policy? When I think of policy, I think of new voices, Latasha's gone, now it's Kelly, Miss Tony. What are the policies that we need to be focused on? How do we need to organize community in order to make some change? Like, we don't do this work by ourselves. We don't see ourselves as the expert in all areas. We have a really strong community that we can pull from. Since we have this opportunity on Facebook Live and we have an audience, I want to talk about a couple of other things that we have that are aligned with our action plan. And then also, Alicia and Danae, if there are any projects that you feel that the audience should be aware of. So one of the exciting, I don't know how exciting it is to talk about infant death, but it's exciting to have some of these initiatives that are launching in our county and that we feel are going to be really impactful as we look down the line. So one of those initiatives is our fetal and infant mortality review process. This is another collective process to look at what happens when we have an infant death, and not just what happens from the perspective of medical records and data, but what is the family story? And so that's what's sometimes missing from the process, is what is the family story and what is the bigger context? And then how do we as a community better respond to the whole picture of what happened? I think infant death is definitely not something that we like to talk about, that we want to talk about. It's traumatizing, not only for the families, but just in general as a community of Black women, when the work that we do is around the constant cycle of death, oppression. It goes beyond just infant death to community violence. that we experience in our communities, to the death of Black women and femmes and birthing people, the death of trans Black women at disproportional rates. So it's bigger than just individual incidences. It's what is going on systemically. So the fetal and infant mortality review process allows us to look as a county collectively from another angle at what do we need to do to prevent infant death. And in our process, we're looking at those infant deaths that happen before the family leaves the hospital. So this is really looking from, again, a more medical perspective, a more health-based perspective, as opposed to looking further down the line, which also would include like sleep-related deaths, which is, another crisis in our community is those sleep-related sudden and unexplained infant deaths that we need to get a hold on. So excited to launch this process for us. And it's important for community to know about this process because we need families to be willing to tell their stories. And so we are engaging with, we call them parental interviewers. And two of our, I think, most trusted community members who are well equipped to do this work, Ngazi Tibbs and Montia Brock, are our parental interviewers. And so what happens is, if the family does suffer a loss, there are things there's information and messaging that they get in the hospital setting. And they would be informed of, someone from the health department or our FEMA process may be contacting you. And of course, the family has, the parent has the opportunity to decide whether or not they want to engage in this process. But it's really important for us to be able to look beyond the numbers and the medical records, because sometimes those medical records are telling the story from only one perspective. And if we don't tell our own stories, then our own stories don't get told. So if when we do have those losses, it's important that families are willing to share their stories if it's comfortable for them. And then I can't, I'd be remiss if I didn't mention our gala. On May 19th, we have Tatiana Ali as our guest here in Pittsburgh. She is a maternal health advocate based on her own story and experiences. I think over the last couple of years, one of the things that have elevated our focus on Black maternal health is the celebrity stories that have come out around their own experiences of not feeling heard. So it's like, it's not a thing. It's not about money. It's not about poverty. It's not about lack of education. It's not about a perception that Black women don't care about our health or, have all of these unhealthy behaviors or uneducated ways, because the data tells us more education and more, economic stability is not a protective factor. So that's why we look broader. We say it's not about us, it's about the system. It's about the collective of the society that we live in. So Tatiana will be here to tell her story. We hope that you will join us. It is a fundraiser. So, just keeping that in mind, we're selling tickets. We have a host of sponsors, the Heinz Endowment's Highmark Cold Care. The health department is supporting us, Pittsburgh Business Group on Health, PJ Dick. I don't want to be forgetting anyone. I think I've named everyone. So excited to be planning for that in the midst of this work, which at times can be emotionally taxing. There is a time to celebrate. This is Healthy Start's 30th year. And we can celebrate that we've not had infant deaths in the last couple of years from families in our programs. I will say that we have seen infant deaths among families that we've not been able to reach and engage. And not saying that Healthy Start is a silver bullet. What we see across programs and systems, from the programs that the health department has to other home visiting interventions, is that those families who are hardest to reach, there's a pattern among those families who are disengaged from a lot of supports that could help them, are those families that we're seeing having tragic outcomes. So not that programs and services are a silver bullet, but parents need support. That, I think that's kind of that's the point. Parents need support. We don't want families feeling like they have to be an island, especially when you have a new child and a new baby. That's why there's this call for doula supports. Let a doula help you to navigate the challenges from the beginning. And it doesn't even have to be, again, that you don't have any personal, emotional, social support. It's just another person that can help you along your way, whether prenatally, during your delivery, and postpartum. Let someone help you after you have that baby. Get some rest. Let someone else do a little bit of cleaning. Let someone else make sure that you get to your doctor's visit. That's important, getting to your doctor's visit after you have that baby. We celebrated the fact that April 1, Medicaid coverage is extended to 1 year postpartum. Let's not let that extension be in vain. Moms, get back to the doctor, get back into your preventive care. If you have high blood pressure, which we see a lot of in the population we serve, that can lead to if you don't get that in check and under control, you can be in a really bad place, for the rest of your life. So begin to take care of yourselves, whether it's, whatever type of holistic, healthy lifestyle you believe in, get into that and do that for yourself. So I'll stop talking. Alicia, Danae, anything exciting that you want to make sure folks are aware of in your spaces?
Thank you for bringing that up, because I actually want to talk about it. I've been working in this space in maternal child health for like 25 years, and we've always had a big focus on those who are pregnant or about to have a baby. But really, Jada mentioned the perinatal periods of risk. That really informs us from a data perspective that the focus that we really have to get our heads around is healthy people before pregnancy, right? How do we ensure the health of all people before going into being pregnant? And also respect, reproductive justice, the bodily autonomy to make the decision to choose or not to choose to have a baby. So women's health, about 15 years ago, there's been this discussion in public health about putting the W back in maternal and child health, right? Because really it's about, from adolescence on, what are the things that those who are biologically female need to focus on if they want to be prepared for a healthy pregnancy and delivery. There's some things that we just, like, if you have some health issues, which we just did a study recently, and really found that people felt unhealthy prior to getting pregnant. And we know that that's a very core, important part of your life, to be healthy before getting pregnant, because pregnancy often exacerbates health conditions that you had prior to pregnancy. And so how do we have that conversation? And so the health department, in partnership with the State Department of Health, Bureau of Family Health, is launching in a couple of months an initiative to focus on your health prior to pregnancy. One of the common misconception or challenge that we're having in our community is, once you go from, even though we've extended, you can be on your parents' health insurance up till age 26, if you're in college or, so forth. What we've learned is a lot of young people stop going to the doctors after the pediatrician, they're no longer eligible to see their pediatrician. They don't go into another medical home setting, when that's very important for everyone in every family to have an identified medical home. And also make sure, like Jada said, to go and get preventative visits. If you have any type of health conditions, that they are managed by a trusted physician that you've chosen. It's so important. And I just want to reiterate that like 5 times. It's so important. I know there's challenges to it, but make sure you find a physician, because there's lots in our community that really want to see everyone healthy, and you have the right to choose that person. And maybe it might mean you have to date a few before you figure out the one you like, but it's still important to go get a preventative visit. And under preventative visits, I would like to offer that it includes dental. It includes, going to a family physician or some type of general practitioner. It also includes going back for obstetric or gynecological care. It also means going to get a mental health checkup. If we have, been diagnosed at some point with some type of mental health disorder, and we've just chosen to stop getting that care, that's also a part of your health, is your mental well-being, and making sure that someone is also giving you high quality care and culturally responsive care as it relates to both your mental and physical health. So those are the things that we're talking about, all of the things. And so I really encourage folks to think about that in terms of being a whole person wellness, and really including that into your plan of life.
Yes, everything that both Danae and Jada said. And so I'm not sure who our audience is today. So if anyone here is representing an organization that focuses on maternal and child health, one real tangible action item I think that you can hopefully use as a takeaway is to use this action plan within your organization. Think about what are some of the strategies that we've outlined and that we've talked and got a lot of feedback around. What are you already doing? Are you connected with us? And if not, how can we be connected? Because one thing we found, which was really eye-opening to me, is that we have 56 different organizations in our county, in our region, doing work that focuses on maternal and child health. So how do we coordinate? How do we make sure that what we're doing is efficient, it's effective, and the impact? So is our impact, are we having the impact that we think, that we hope that we're having? If not, how do we evaluate that? And so really being able to come together and work together. Jada talked about reducing our silos, so did Danae. And I think this is really a first step. I also hope if any of you all are connected to funders, funders come up all the time and say, what are the priorities? We see the data, we hear the news stories, what's happening, what can we support? This is a really good place to start. These are some priorities that we've already identified. We've done all the work. Now let's really put some funding behind it and making sure that we're prioritizing community organizations, community Black-led, women-led organizations. So that's my soapbox about us working together, because I really, really hope that this is a step in us changing how we provide services. And then lastly, putting on my March of Dimes hat, we have an exciting opportunity for those of you that want to be involved, that want to do more work around advocacy. Next month, May 23rd, we are hosting our virtual Pennsylvania Lobby Day. What that means is it's an opportunity for you to talk to your lawmakers and say, hey, these are the priorities for Pennsylvania. They align with this action plan. We're going to be focusing on doula care, Medicaid extension, as well as paid family leave. These are our priorities. And so we want to know that A, you support them. If you don't, we can provide some context. And we just want you to know that this is, we're your voice, we are the people, and we are speaking out. And so I will send to Jada and Healthy Start the link for people to register. Again, it is virtual. We provide a training for folks who might not have talked to lawmakers in the past, don't know how to schedule meetings. What does that look like? And so this is a day to activate, to be really energized, and we hope to have more of these to come. Because I want to note that policies are great, right? We have a policy and we make a change, but that policy has to be implemented for it to work. It also has to have funding and it needs to be sustainable. And so we want to get these priorities, and our lawmakers, we want them to see that these are priorities, and we want them to know, but we also want them to think about, well, what happens after it gets passed, and how can then the community organizations, those of us that are leaders in this space, how do we then make sure that they get implemented in a way that's equitable? And so we need that level of accountability from the people. And so this is a really great opportunity for you to be involved. Again, it's on May 23rd. It will be virtual. We'll be scheduling a bunch of meetings with lawmakers across the state to really get them activated around maternal and child health priorities. So thank you.
Thanks, Alicia. Thanks for making us aware of that. And we're definitely looking forward to supporting and, getting our network together so that we have representation, because that's an important, we have to speak up. We have to have representation. I think that the political process, for a lot of us, it can be confusing. You don't know what becomes of the things that you do, or even how to get started and get your foot in the door. But I think it's important that we pay attention to what's going on. So Morgan Cephas, who's on the other side of the state and is a great partner for all things maternal and child health, and an advocate, has been in Pittsburgh a couple of times in the last year. And one of the pieces of data that she shared that stuck with me, I think she shared it at our legislative breakfast last year, was that 10% of our nation's, the maternal deaths that we have accounted for, 10% happen in our state. So that is a huge disproportion. Like, what's going on in the state of Pennsylvania that we're bearing the burden of 10% of those maternal deaths? So just like things like that just are really eye-opening, and make you want to dig deeper and make you want to better understand, and then have those conversations with our legislators. What are you all doing? How are people being held accountable? What are things that we can be doing in community? So I think that the more you lean into understanding what's going on, the more you're like, okay, I'm compelled to do something about this. So definitely, I think our community health advocates, shout out to our community health advocates who continue. I've said once we got our hooks in you, we are going to, keep you busy. So I think that's a great opportunity to engage our community health advocates, because they are already doing things in their community and have a passion for this work. And we just see ourselves as presenting them with additional opportunities. So I'm definitely looking forward to that. May is going to be a busy month. Our gala, your advocacy event, Gwen's Girls Gala is happening in May. Cribs for Kids has an educational symposium in May, and definitely want to shout out the need for us in our community to focus on sleep practices and just all of those other things that we may not think about that impact our communities and our babies and our trajectory and our livelihood. It's nothing is worse than hearing about a preventable infant death. There's nothing worse than hearing about that. I think, maternal death is neck and neck to that, but hearing about those babies that died, that it didn't have to happen, that's, no one wants to go through that or to have to review those cases. But with that said, we are nearing our hour. Thank you so much. Thank you, Dana and Alicia, for riding through this conversation with me and through this process, and just being a part of our Healthy Start family and doing your respective work in your respective spaces is so important. I always say I would love to just have to envelope everyone into the Healthy Start space, but we need to be in all spaces. We need Danae, we need you at the health department fighting that bureaucracy. Alicia, we need you at March of Dimes doing that national work. We need our community folks and our independent birth workers doing things their way. But I definitely see the connection and the connectivity and the opportunity for as long as I can and I'm able to be leading Healthy Start to support this work in all of the different spaces where it's being done. I don't see any specific questions from our live audience, but I thank you for being here with us. Please share the plan. Again, it's on our website, www.healthystartpittsburgh.org. Share it, give us feedback. There will be more activities to come. Our next steps are to roll out the plan among specific audiences. So for example, Muffy from Pittsburgh Brown Mamas has been part of the conversation of supporting us with some rollout strategy, and definitely believes that we should share this within the Brown Mamas audience. It might be a different conversation. There might be some specific aspects of the plan that Brown Mamas want to focus on in terms of understanding it and giving us feedback within our different health networks. Alicia, you may want to roll it out for March of Dimes and have a conversation around a specific space that March of Dimes can really latch on to. So that's why we're here. That's the point of the plan, is to really see it adopted across different spaces and keep community updated and involved and engaged as the plan rolls out. So thank you so much for this hour. Please feel free to reach out to any of us anytime if you have feedback, suggestions, or ways that you want to be involved. And as always, thank you so much. Thank you for all the work that you're doing. We are saving lives. We are impacting community. We are creating spaces. I'll just say where Black women can see a future in Pittsburgh. It's hard. It's an uphill battle, but we are here together in community. So thank you, everybody. And with that, enjoy the rest of your day. Thanks, everyone. Bye-bye.